He had hair transplant. He paid $1 a graft. They literally sewed the wound edges together and didn't really trim the hair in the back and sewed all that hair into his wound. I took him back and I was like, my goodness, I mean, this is serious stuff. You have to do your research.
Most people never hear what really happens when overseas hair transplantations go wrong. We do, because patients often come to us to get them fixed. Today, we're sharing some of the worst cases we've ever seen. Men who woke up after getting 4,000 grafts pulled from their heads without their knowledge, thinking they were getting 1,000 grafts. Patients sedated without consent and left in agony for 12 hours. Infections so severe, people came to us begging for help. This isn't about shaming anyone who went overseas. It's about showing you what really happens behind the flashy Instagram ads and the inexpensive promises. We want to help you avoid the same mistakes.
Today, we're going to talk about overseas hair transplants and our experience with some truly botched jobs. There are some patients that do well. There is a much higher percentage of folks that don't. We had a patient where we did 2 cases. I actually did like 3,500 grafts, all FUE from the back of his head. Super happy. And he said, you know what, doc, I'll call you if I need you. And then ended up going overseas. They took 4,000 grafts. He was just wanting a little touch-up, maybe 1,000 grafts.
And they did 4,000.
They completely sedated him. And he woke up about 12 hours later. They took 4,000 more grafts. There's literally no hair on the sides, especially on this left side.
Because they've over-harvested.
Oh, gosh. And so he came to the office 2 weeks after he was there, and he was just devastated. We're going to help him, but it's going to be, quite a process. And it may take a couple cases to get it done, extracting from beard and chest, putting it back into the head donor, and using medication management to get this better. But it's not something he signed up for. I have never had a single patient that I feel that I could safely do 4,000 grafts from the donor site at one time. It's impossible to do it safely. I've heard other stories of patients having very poor pain control with a massive language barrier. One of my patients said the translator is there for just 2 hours. It was a 14-hour case. They took 5,000 grafts. And I was seeing him because we were putting beard hair back into his donor site. He said that the pain was so bad. He said, I'm this tough guy from Jersey and I'm literally weeping, and they showed no empathy. And this is a true story. And I hear this a lot. They thought the doctor was going to be involved. There was no doctor involved. Many times they get fully sedated for 10, 12 hours, not knowing what's going on. And they wake up not knowing how many grafts were just taken.
Very misinformed.
Oh, yeah. I think people get enticed into this thing that if a clinic has 1 million followers on Instagram, that they must be the place to go.
Right.
You know what I mean?
They buy into the sales pitch.
Yes. I had one patient, this is probably back in 2016. It was a Friday afternoon. I was just about to leave. He spoke very little English, and I think he was originally from Mexico, and came into the office and said, I need your help. He had hair transplant where they did 2 strips at the same time. So they did one higher up in his donor area and lower in the donor area, which is a big no-no. And he paid $1 a graft. They literally sewed the wound edges together and didn't really trim the hair in the back and sewed all that hair into his wound. And I took him back and I was like, my goodness, I mean, this is serious stuff. And I worked on him, I'm not kidding, for an hour and a half, pulling hairs out, decompressing abscesses. And he actually had him come back 2 or 3 more times. And I felt so bad for him. This guy was absolutely suffering. The problem with hair transplant is it's easy to go from one clinic to the next. And the bad clinics don't care. They did their procedure and they move on to the next person. And they're not looking at the individual.
Yeah. I mean, we take a lot of pride in our post-procedure follow-ups and have routine scheduled consults post-operatively. At 6 months, you're going to meet with us, and at 12 months.
We want our patients to be fully cognizant and have a great experience and remember that great experience so everybody feels comfortable. If you're a patient watching this video, you need to be cognizant to the fact that you have to do your research. there's no like time frame to get hair transplant. And oftentimes hair transplant isn't the solution, or maybe not the right solution for you. You can't compare everything to the glitz and glam that you see in Turkey or Mexico or any other international place that's heavily marketing.
Right.
You also need to look at some of the resources, and some of the great resources are the ISHRS, which is the International Society of Hair Restoration Surgeons. They have a great website. They are very proactive on this thing called Fight the Fight, where they're fighting these clinics that are just literally preying on patients. So that ishrs.org is a great.
Yep.
The next one is the IAHRS. That's the International Alliance of Hair Restoration Surgeons. I'm part of that. There are about 100 in the world. And really focus on empowerment. I think that's the biggest thing. I mean, all these videos that we do and even the talk today, it's really to empower the patient, the consumer, to make the right decisions to move forward and not end up being preyed upon and having bad results and spending more money and just despair.
If you're considering hair transplantation, do your research and don't rush. If you found these stories helpful, subscribe so you don't miss the red flags we'll cover in future videos. And leave a comment with your questions. Thanks for watching.